So this is part 2 of the major pattern presentations class. And for those who don't know, I'm Michelle Morisi, licensed acupuncturist and practitioner of Chinese medicine in the greater Providence area. And so we went over last week the major patterns of deficiency patterns in Chinese medicine. So just quickly to skim through the deficient patterns, we talked about qi deficiency, yang deficiency, blood deficiency, and yin deficiency. And so if you missed that one, you can go back and watch that in Wu Healing Group on Facebook or the YouTube channel Dr. Wu Healing. Today we're going to cover excess conditions. So to start, talk about qi stagnation. So, and just as a note, oftentimes excess and deficient conditions can coexist. So sometimes there's actually an underlying deficiency, like there might be a deficiency of qi that prevents it from flowing smoothly and leads to it getting blocked up in certain areas. But for now, we'll just focus on these conditions kind of existing in a vacuum on their own. So with qi stagnation, this can present in a number of different ways. So it doesn't have to present with all of these or even necessarily any of these symptoms. But typically there will be these symptoms, either or both emotional, physical, mental, and then of course there'll be the pulse and tongue presentation, which if you've seen my classes on the pulse and tongue, that'll be just a quick reference back to those videos, which are also on the YouTube channel and the Facebook group if you want to go back to those. So qi stagnation, it tends to this pent up energy, so you might kind of feel pent up. You feel it's like a traffic jam, which oftentimes we tend to feel qi stagnant in traffic jams. Tends to bring up our frustration. Qi stagnation can also present as fluctuating moods. Typically, frustration is an emotion that goes along with qi stagnation, but sometimes it can lead to depression if this energy is just kind of never released and pent up and just gets kind of more and more deeply repressed. And then, so the qi stagnation is typically an issue with the liver. So the liver is in charge of the smooth flow of qi in our bodies. It also plays a big role in the blood. So for people who menstruate, it may affect their cycles in terms of the regularity of the cycles. It could also lead to cramps or pain, but that could also get into blood stagnation and moodiness around your period, PMS. That has a lot to do with the liver and qi stagnation usually. It could also just be pain in general or discomfort that comes and goes, or it's not really fixed in a certain spot. So as opposed to blood stagnation, which we'll talk about later, which tends to be sharper, more fixed, more of a exact point or line that you can indicate where the pain is Qi stagnation tends to be a little harder to pin down, and it can also lead to bloating, so in terms of digestion. And in general, look for symptoms that change in severity and location with Qi stagnation. And so if you remember, or you want to take a moment to remember the pulse and tongue associated with Qi stagnation, if you've seen those or you have familiarity with pulse and tongue diagnosis, this, I'll just say that this person's tongue pictured here doesn't look particularly Qi stagnant. It looks like quite a healthy tongue, but could be getting there. So with Qi stagnation, the pulse is usually called wiry. It could be called tense, different translations of this term out there, but basically it feels taut and like a rebounding, like it's rebounding against the pressure of your finger at all the three depths. So some people say it kind of feels like a guitar string, like a literal wire. And as for the tongue, I learned this as a dusky color to the tongue, so it's like a bluish tinge. Some might say that the tongue would present with like red on the edges and the tip. This is particularly the red edges would be probably more so Qi stagnation in the liver leading to heat. And then the veins may appear slightly distended and bluish in color, but maybe not. So, but those are possible signs to look out for with the Qi stagnation. And I unfortunately don't have I couldn't find a great picture of a Qi stagnant tongue, but the dusky is like a bluish tinge usually to the tongue. And moving on to blood stagnation, we talked about a little bit already. So as I was saying before, this is more of a fixed stabbing pain. So this person here actually doesn't look like they're in too severe of pain, maybe more like Qi stagnation. But it can lead to menstrual cramps, particularly premenstrual cramps. So you're feeling that before the period starts. With excess conditions, there's relief once something is kind of emptied out. So if there's cramps after the bleeding starts, that's more a blood deficiency. A lot of times people have both, so there might be some cramping before the period starts and right after it starts. So it could be a little bit of both. Also clots. So menstrual clots is a sign of, you can literally see the clumped blood. And so depending on the size of those clots, it could indicate the severity of the blood stagnation. If it's smaller than a pea, bigger than a pea, that would be more severe. And the color of blood that has been stagnating is darker. So if someone cuts themselves in the blood, or with acupuncture sometimes you'll see a vessel will get nicked with the needle, and sometimes the blood is really dark, and I make a note of that there's some blood stagnation. Varicose veins is another clear sign of at least local blood stagnation. The complexion may be kind of darker and duller with someone who's blood stagnant, or kind of purplish, like the color of stagnant blood. So those are some signs to look out for. But yeah, most common is probably pain, really severe pain, or sometimes immovable masses. And so pause for a moment just to reflect on the pulse and tongue, if you remember, or if you maybe can guess some things about how the pulse and tongue would present based on the typical symptoms of blood stagnation. So the tongue tends to be purple with blood stagnation, have a purplish hint to it, or just flat out look purple. Often I'll see like a reddish purple, which this tongue pictured here is more of a reddish purple. So a combination of heat and blood stagnation. And the veins under the tongue might also be purple, and the more distended they are, the more blood stagnation. So just like with varicose veins, it's a similar thing, just underneath the tongue. And the pulse is called choppy, which can present in different ways, described in many different poetic ways that you can hear more about in one of my pulse videos. But it's typically like an uneven, rough kind of feeling, and sometimes irregular in strength and fullness. So it feels like the pulse, the shape is kind of changing as you from one to the next. So that is indicative of blood stagnation. And moving on to full heat, as with anything heat related, there's going to be redness, redness of the skin, maybe red eyes, and the person will literally feel hot and agitated, perhaps, thirsty with a desire for cold beverages, yellow or green discharges. So clear or whitish is more indicative of a deficient condition or cold in the body, whereas the yellow or green is indicative of heat. Could be like a bacterial infection, so that can lead to some heat in the system. And then pain is going to be worse with pressure. With any excess condition, it's going to be worse with pressure. Deficient conditions are better with pressure. And then just kind of common sense, if it's worse with heat and relieved by cold, that can indicate a full heat condition. And they're probably going to be constipated, or that's a typical digestive symptom with full heat. Constipation. So it's like the heat is drying up the system too much to let the stool pass. And I'll pause for a moment to let you think about what the pulse and tongue might present like. So in full heat, the pulse is going to feel full, so that's a strong pulse at all the levels, and rapid. So whenever it's rapid, that's a sign of heat. If it's more like a thin, tight pulse with a rapid rate, that's going to indicate empty heat, so yin deficiency. But if it's a strong, full pulse, that's indicative of full heat. So we're going to see probably a red tongue with a yellow coat, and dry. Heat dries up the moisture. So that kind of all makes sense for a full heat presentation. And on the other end of the spectrum, full cold. So someone who has full cold will probably feel cold, and coldness tends to contract. So if there's it could lead to some pain from that contraction, and this pain would likely feel worse with pressure. Like we were saying, every excess pattern feels worse with pressure. So if there's pain associated with it, massage pressure might make it worse. And then it's obviously going to be worse with cold as well. So icing will not help, and it'll be better with heat. And like I was saying before, the discharge would be clear or white and copious. So yeah, this kind of pattern, I don't really see this too often. So it's probably, someone with a decent or, strong constitution who has been exposed to some kind of environmental cold, or perhaps it could be a dietary source of the cold, but then I would think they might have more of a deficiency from from a chronic cold diet. So yeah, more so I think about like cold environment, or perhaps something, medication like antibiotics for an extended period that can be cooling to the body. So those are the two kind of things that I would think of: a cold environment externally, or medication like antibiotics leading someone with a strong constitution to have this full cold condition. And it was also hard to find a tongue that paired with this condition, just because it's not too commonly that I see it. So the pulse again would be full, but rather than rapid, it would be deep, so palpable at the lower level, and tight or thin and hard. And then the tongue, as opposed to red, would be pale rather than dry, would be wet, and the coat would be thick and white. And then next, dampness or phlegm. So these are paired together, but phlegm tends to be thicker and drier than dampness. And dampness can present with several different kinds of physical, emotional, mental symptoms, just as with all these conditions. But dampness, I find to be really common, at least in our culture. So on a mental, emotional level, it could present as like a brain fog or excessive worry or rumination. Excessive worry or rumination can also lead to dampness, or it can be a vicious cycle. Feeling kind of heavy, weary. There may be edema, right? So this retention of fluids, or congestion, like in the sinuses. It could manifest as excess fat, and underlying that could be an overgrowth of microbes or pathogenic microbes, bacteria, fungus, it could be virus, but some kind of overaccumulation of something. Digestively, this could lead to sticky and or watery stool. If you have a damp skin condition, it would be fluid-filled. Skin eruptions, it could be a damp heat situation, so kind of red, fluid-filled skin condition. And then phlegm can also present as mucus or like masses in the body, and it can also present as mental illness. So phlegm, there's a couple different conditions like phlegm misting the mind, or phlegm fire harassing the heart, or a couple different pattern names that can manifest as a variety of different mental illnesses. And I'll let you think for a moment about what the pulse and the tongue might look like. And then this picture here is just kind of representing someone who's overwhelmed, maybe full of worry, just kind of things are all disorganized and cluttered. Yeah, just too much stuff that's not the chi is not being things are not being properly transformed into chi and transported where they need to go, leading to any of this like over accumulation in the system. So there's different ways that the tongue can present for dampness and phlegm. So just a couple different examples pictured here. The top one, more of a damp heat condition, as represented by that yellow color of the coating. And then the bottom, more of a damp cold, perhaps, with the full white coat. And so you can see, at least on this bottom tongue, pretty deep indentations or scallops on the side of the tongue, so that might be seen on someone who has a damp condition. Also a swollen or puffy tongue, so it's swollen is wider horizontally, puffy is bigger vertically, but both indicate some kind of dampness. And the coating is going to be thick, whether it's white or yellow in color, as we just talked about. It may be kind of greasy. So that bottom one looks a little more like a greasy tongue. That top one looks a little more dry. So there is, like I said, damp heat. There might be, looks like, a crack there in the middle of the tongue. So maybe the dampness and the heat is leading to depletion of the yin. You also might see kind of foam on the tongue or phlegm strands, so like these just like strands kind of connecting from the tongue to the roof of the mouth. And then the pulse is called slippery, and this feels like a rolling on either side of the finger rather than under it, like right under it. So it's kind of hard to put your finger on. It feels slippery. So that is how the pulse and tongue will present for someone with a damp, possibly phlegm condition. And just a recommended resource if you'd like to dig in more, GiovanniMachocha.com. So I've recommended his book in the past, Foundations of Chinese Medicine, but this is probably more accessible, really good resource, lots of different pictures of tongues and analyses of them. So yeah, that's a great resource. You don't even have to buy the textbook. It's just a good resource for you to check out. And again, my name is Michelle Morisi. And if you have any questions, you can feel free to get a hold of me at this email or number. If you want the slide deck, feel free to email me and I'll send it along to you.